The pandemic will take some time to end, but the emergency of COVID-19 could end this year.
The World Health Organization says some countries may have been experiencing a resurgence of COVID-19 cases, but there are countries with low-risk case classification. WHO Technical Lead for COVID-19, Dr. Maria Van Kerkhove, said there are a lot of ways to eventually cut COVID-19 transmission and prevent the disease to progress.
What we mean by that is really taking the death and devastation out of COVID, and we can do that now with vaccines, with early diagnosis, with better clinical care. And we have a number of therapeutics, particularly for severe disease, but we have a number of antivirals that are recommended for earlier clinical care so that people can get the care early so that they don't progress to severe disease.
WHO has yet to announce the next steps when the global COVID-19 emergency finally ends. WHO officials also emphasize COVID-19 will remain like other infectious and deadly diseases. This is why being a responsible and compliant citizen amid the pandemic is important.
For the people that are listening to this may, be discouraging, but I think what we want people to hear when they hear us speak is a sense of hope and a sense of that this will end. That is something we can say for sure. The problem is we can't say exactly when. But this pandemic will end with our actions. And so all of us have a role to play. All of us have a role to play, no matter where you are, no matter what kind of job you have, no matter what your age, to get us closer to the end. And so what we want to see is everybody really working hard, living their lives, but being careful so that we can get closer to the end of this emergency as well as ending the pandemic.
WHO Regional Office for Western Pacific Dr. Babatunde Olubokure meanwhile emphasized the importance of COVID-19 vaccination with the emergence of COVID-19 variants.
While the virus is circulating anywhere in the world, we can still have an outbreak. So even if we bring it under control in this region, as long as it's circulated in Europe, America, or somewhere else, it can be introduced. Or it may be a pocket, as Maria has said, of unvaccinated people within your own country. And if you have that pocket of unvaccinated people, they can seed outbreaks in other parts of the country. And that may lead to a surge, which is why we really need to have very good systems in place to be able to detect early, respond early, and contain that particular outbreak.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.